The people who's in favor of Medicaid being cut drastically and think it's not going to affect you, and in fact it's going to help you, I want you to honestly think about all of these things. Medicaid is a major funding source for many hospitals, including rural and community hospitals. If they no longer have Medicaid coming in and you have patients coming in with emergencies, you still have to treat them. You still have to treat people whether they have insurance or not in an emergency. So now that people are still going to be getting the same care, but now the hospitals aren't going to be reimbursed. And if hospitals aren't getting reimbursed, they can't keep the lights on. They can't pay their staff. They can't get the supplies, the equipment. Is this all making sense? So then they can't pay anyone and they have to shut down. And you're like, great, but we still cut Medicaid. We're saving all this money. Okay, so now the hospital shut down, which means everyone's gonna have to divert to the other hospitals, which may not be close. It may not be close. If you're also one of the people who's proposing that more women should get pregnant and have babies, where are the moms going to go to deliver their babies? What if they don't have a hospital nearby? What if they don't have access to care? Or if they can't get in anywhere? Because when more hospitals close, right, they're gonna have to divert to other places. What do you think is gonna happen with the wait times? Now you need to go to the hospital for some reason. You have insurance. How much longer do you think you're gonna have to wait now that there's no other hospitals nearby because everyone's going to one place? The wait times are gonna get longer. The healthcare staff is going to be stretched more and more thin than they already are. The hospitals aren't going to hire more staff. They're just going to stretch the staff thin. And care is going to decline. It's going to take longer to get care, and the quality of care is going to go down for everyone, not just people with Medicaid or who don't have Medicaid. No insurance at all. It's going to affect everyone. Do you know how many children have Medicaid in this country? Not only are women and children going to be affected, but we keep talking about how we have a mental health crisis and we're in a mental health epidemic. What do you think is going to happen when mental health facilities and mental health units are being shut down? Where are these people going to go who are in crisis? Where are these people going to go when they need a mental health provider and there are none? If we think we have a mental health epidemic now, wait until Medicaid is cut, because how many people who get behavioral health services have Medicaid? Not all people, but a lot of people. So there's a trickle-down effect. There's more than just a simple, we're cutting Medicaid and it's gonna save us money. Think about all the money it's gonna cost for all these things, let alone not just the money, but these are people's lives. So what do we think about homelessness? What are those rates gonna happen? Incarceration, people with a crisis, maybe who's feeling like they don't want to be alive anymore. They might not have somewhere to go. So just think about it.